So let's just have a little word of prayer before we start.
Amen.
Heavenly Father, thank you for bringing us all here together to fellowship with each other, to learn from each other, Lord, and thank you for all the teaching that you've given us. Thank you for the intelligence, for all your many gifts that you've bestowed upon us. And Lord, as we open another session this morning, I ask that whatever I'm able to teach will be of some benefit to someone here, is my prayer in your holy name. Amen.
Amen.
Well, so I've had a long journey. Just tell you a little bit. Medical school out of the country makes it much more difficult to actually practice here or get to practice here, as far as getting into residency programs and all that. So after about 5 years after graduation, I finally got it. Well, there's some more before that, but I actually got into an internal medicine program for a year. It's called a prelim because it's usually for people who want to go on to do something like neurology or something like that. You know, my whole life I've been interested in medicine. From 3 years old, I proclaimed that I was going to be a doctor. Never changed my mind since then. But there was always this yearning to do different things as far as in the medical realm. So I always knew that herbs worked, and I always knew that I wanted to be able to do that, and I wanted to do chiropractic, and I thought, well, I'll just get all these degrees and I'll just be knowledgeable in all this stuff. And of course life never works that way, because I call myself a late bloomer because I just got married, just had a baby, just, you know, all these things. Just finished my residency program, and I'm 42. So my journey through medical school, I got a full scholarship for medical school. I completed it, then I couldn't get into a residency program. One of the things that happened was my grandmother got sick, and she was the love of my life, and so I stopped everything to look after her until she passed away. And so I practically was given a spot in Wisconsin and had to turn it down because I couldn't go ahead with my exams because my mind was not there. So didn't know enough about natural healing then to help her, you know, so she did chemo, and then she passed away after 2 years. And then I worked in my country for a year, third world medicine, not easy, lots of experience, good experience. Came back to the US, I always wanted to do oncology. Cancer was always my passion, you know, trying to find ways of healing cancer. I knew there was chemotherapy, but I also knew that it was bad side effects and there was a better way. Well, came back to the US, and of course, the only job I could find, an MD degree is useless unless you have a residency program. So I was useless. I had the only thing I could do was actual clinical research. So I was funded by an NIH project, and I did a whole year of research in oncology, where I used chemotherapies on different kinds of cancers and pancreatic cancers and all these kinds of things, and found out real soon that no, it's not good to kill all the cells. But I thought that was the plan. No, because then we'll kill the person too. Wasn't a good idea. Couldn't stay doing that for the rest of my life. I mean, just being in a room by yourself, I'm too much of a people person. So did that for a year, got into a residency program in New York for a year to do internal medicine. No guarantees of a second year. So I did my year, did well. Everyone was rooting for me because they did have some positions open, but there were more of us that needed positions than there were positions open. So some of the other people had contacts within the system, so they got this position. I didn't, And my colleagues and some of my professors came to me in tears because I was the hardest worker. I was always dependable, and they couldn't believe that they would put these people who were not as dependable, who weren't as hardworking, in the spot instead of me. But I had this calm that came over me. And I never cried. I'm crying now. Because my answer to them was, God has a plan.
Amen.
And the way He orchestrated this whole thing happening for me was amazing, because if I had gone ahead in my residency program, I'd have never known as much in natural healing and the health message as I do now.
Amen.
Because during that time off, when I was looking for another residency program to get into, I was studying for my boards so that I could be ahead of the game when I got into a residency program. Northeastern Conference was having medical missionary training classes. And so I heard about it and I decided to go there. But before that, over in Washington State, there is a retired pastor that has a wellness center. And he was also a conference secretary and all that over in that area. And I went there, and at the time I had just met my husband. It wasn't my husband at the time. And I went there for a week with one of my best friends. And we started hearing all this research about the way to get rid of diabetes and high blood pressure naturally, and just changing your diet and the amazing effects. And I'm like, well, how didn't I know about this before? Why am I a Seventh-day Adventist from birth and not know about this? You know, I called up my husband and I said, you cannot believe the things I'm learning. And he says, well, what are you learning? And I told him, and he said, oh, yeah, I've known about that. I was trained as a medical missionary for 3 years. I said, well, you never told me anything. He says, I wanted you to find out on your own. I never want to force anyone to do anything. So from there, it just took off. I came back and they asked me to come back to be the doctor on the campus there for another session that they had, because they had really sick people. And the amazing things that happened were just mind-blowing. And so now I come back and I do the medical missionary course. And at the medical missionary course, there's this naturopathic Adventist guy, and he's up there. The things he's saying, I'm like, oh my goodness. I walked right up there after and I said, I need you to teach me everything you know. I'm a physician, but I need to know what you know. And so for the next year, I followed him around. We were medical missionaries, solely supported by medical missionary work. And he has a family and, you know, all that. And so I learned a lot from him. And I had a friend who is also a medical missionary. He's been doing this work for a long time, and I learned from her. And it just took off from there. And so here I am. Have helped a lot of people by God's grace. People that you never expect. The way to get this message out it is through the right hand. And people like, I know you guys have heard of Benny Hinn. I know you've heard of his evangelical ministry on television. And I've treated one of his pastor's wives with MS. And she wasn't walking for 8 years. And then in 7 days, on the Sabbath, by the way, she started walking. And I asked her husband, well, why hasn't Benny been able to heal her? And he said, well, I just don't think her faith is strong enough. But let's start on the business at hand. Wound care is what we're here for. And I want to tell you that I'm going to start on honey, because this is actually something that I've used in the hospital many times, because now there's research about it. There's medical research. There's medical honey. Medical grade honey is what we use in the hospital. They put it on bandages so that you can use it in the hospital. You know, of course, they take all the possible bad things out of it, but like the botulism and all that stuff. But the manuka honey is what they really use, and it's full of all kinds of stuff. So the reason why honey is, well, there's several reasons. I mean, honey is a multifold reason, like most herbs, or natural substances. They can be used to do multiple things. So one of the reasons that honey actually works so well is because it draws moisture out of the wounds. So out of the environment that it's in. And there's something you need to know about bacteria and funguses. They love moisture. And so if there's moisture, they flourish. They also love warmth. And with that moisture and the more the decay, the more warmth they have. And so now the way to help wounds would be to get rid of moisture, get oxygen there, get circulation there. A lot of the times we have unhealing wounds because of a lack of circulation. Remember, Sister White talks about perfect circulation equals perfect health. So if we don't have proper circulation, we're not going to have proper healing. The other types of wounds are in diabetics, and again, that is due to lack of circulation and because of the actual sugar that is giving food in the blood, giving food to the bacteria. So it's funny that actually helps the wound to be worse, but then the honey, which is a high content of sugar, much higher than what's in the blood, actually is bactericidal. It actually can kill the bacteria because of how intense the sugar content is in the honey. So it actually hinders the growth of the microbes. But of course, that's not the only reason why honey is actually good for wounds. They've done studies where they have actually diluted the honey, and so the sugar content was much less, but it still worked to kill bacteria. So that shows that there's actually several components that give rise to the killing that the honey does, or the healing that the honey does. Something like probably 100 different reasons could be different components of the honey that could be why. Then the other thing with honey is that it actually produces hydrogen peroxide. So there's another reason why it can kill bacteria. We use that as a wound cleanser, right? The only thing is that when we use it usually as a wound cleanser, it actually can have a bad effect to continue using it in an unhealing wound, or a wound that's not healing, because it actually kills the good cells around the healing area as well. But with the honey, I guess it just, God in His wisdom, just enough. Just enough to do what it needs to do. And then of course, one of the side effects, you want to say, of a reaction with peroxide is oxygen and water. So that's even more of help with that.
Getting oxygen to the brain.
Yeah. And then the studies they've done also show that even if they block the hydrogen peroxide forming parts of the honey, it still actually helps to heal wounds. So it's just showing you that there are multiple ways to skin a cat, basically. And the honey does it in multiple ways. And of course, It's also anti-inflammatory. And so the things that cause wounds not to heal as much is all the inflammation around, because the inflammation also hinders the circulation and you know, getting the oxygen there. So it actually down-regulates the things that cause edema and the inflammatory process. It also reduces pain. The reason we usually have pain, again, is because the inflammation excites the nerve endings, so causing pain. So of course, if it's going to be an anti-inflammatory, it's going to help with pain, which is why ibuprofen and all those things, they're anti-inflammatories, they help with pain. So that's about it for honey. I just wanted to talk a little bit about cayenne pepper. Everyone,
I just wanted to clarify, the best way to use the honey, do you put it in the wound? Is it best to put it on a bandage and keep it away so that it draws the moisture out?
Repeat the question.
she wanted to know the best way to use the honey. You can put it right on the wound. Actually, it's better to kind of pack it in the wound and you do cover it up with gauze and stuff too. And probably best to change it every day, maybe even twice a day sometimes. Actually, before I go into cayenne, let me just talk a little bit, since we're talking about packing the wound and with sweet stuff, let's talk about sugar. Sugar actually can be used for wounds as well. For one of the same reasons that the honey, the high amount of sugar can actually be bactericidal. So one of the only reasons we should be using white sugar is actually for wounds. And what it does is actually it melts the sugar, and so it starts pouring out. So you may have to do that several times a day when using it. But it heals it from inside out. You just keep packing it.
You said to clean it every day. How do you clean the honey off the wound? Is that water?
Flush it out.
Just
Saline.
Saline.
Mhm. So the white sugar, brown sugar, you can use both of them, but that's one reason for white sugar.
It runs in my mind that peroxide effect on It runs in my mind that the hydrogen peroxide effect from honey for wounds is only from raw honey, like from
Yes.
enzymes, so it can't be honey that's heated high enough to kill enzymes.
Well, the funny thing is that in the medical honey, they irradiate it so that it can kill the botulism spores, but it has no effect on it.
So, doesn't really matter.
I mean, the best is to use raw honey, because I'm sure there are some enzymes that are killed, but it still has its wound healing effect even when it's been irradiated.
Okay, we'll take one more question, and after that, if you would, write down your questions, and let's let Dr. Rachel get through her presentation.
Yeah, sorry about that, but my question is, like, you keep mentioning botulism being killed, so if a person were to use honey that still had the botulism in it, would it hurt the person at all or anything?
Only babies.
Okay.
So there's no honey in babies before a year old. Because of that, their immune system is not able to take care of it. Okay. So let's go on a little bit to cayenne pepper. Now, has anyone ever used cayenne pepper with wounds? Yeah. What did you use it for?
Stop.
Stop the bleeding.
Okay. What did you use it for?
My good friend Judy Getchell is actually using it to reactivate her thyroid. It's a cayenne pepper poultice. Her number was 14, it dropped to a 9, and then a few weeks later dropped to a 5. So
And-
she's reactivating her thyroid.
That's interesting. See, that's why we need to do these things. So tell me, how long does she put it on each day?
She wears it through the night, and it's probably been a couple months she's been doing it. And yeah, now she wants to contact the medical commissioner as a poultice, and she just covers it with a Band-Aid at night. But now she wants to contact the person she learned it from, Barbara O'Neill, and say, do I need to stop eventually? Will I start like getting into the negative? You know, how do you, once you get to the numbers you want and reactivate, how do you maintain a healthy? That's what she has to learn next.
So
learning process.
what she needs is to detox. Because whatever it is I know we're going off on a tangent, but whatever it is that has caused it, she needs to get rid of it out of her body. So usually it's an infection. It could be just a cold that you've had that can cause that. Causes formation of antibodies to our thyroid, and it happens. So she might be able to, if she gets detox, the problem may go away out completely. If it's done well. Okay. Uh-huh.
There were some friends of ours that.
Okay, wait.
There were some friends of ours that were at Walmart, and the man had a heart attack, and she had cayenne in her purse. She put cayenne under his tongue and saved his life.
Yep. Good cause. Good reason for using it. It's also good for strokes, if someone is having a stroke. The other thing that's good for stroke, by the way, is nutmeg. Biting nutmeg when you're having a stroke. Yeah. Is that it? Okay. So, you guys have come up with all the reasons why it's good. There are other reasons too. It actually, along with bactericidal characteristics, it also has antifungal characteristics, which is amazing because, you know, there are times, especially with diabetics, with the wounds being so bad, it's breathing ground for fungi. So including Candida, by the way, it helps with Candida. So it helps with healing because it's anti-inflammatory, it's antibacterial, it's antifungal. And remember one of the reasons I said that a wound would not heal? Circulation. So our bodies are able to make additional circulation than we already have. It just has to be activated, which is why tumors can grow and to be so huge, because those nasty cancer cells, they know how to activate those things in our bodies to make new blood vessels start growing. And so they have blood vessels where they can continue growing. Cayenne pepper is able to create new circulation. So that's a way it can help with restoring health to a wound. And remember, perfect circulation, perfect health. The way there's been extensive research done on this. So the way it actually kills the fungus, it's by a protein called the CAY1 protein. And what it does is that it attaches which is how these proteins work. They attach to certain receptor sites, and then it's able to kind of inactivate the membrane. It disturbs the membrane so that it can't live anymore. So it basically destroys the membrane. So that's all the several reasons why cayenne is. It's also, like he spoke about the heart attack. That the reason why it saved the person's life is because, along with clotting abilities, it also has thinning abilities, which is amazing because it does two things at the same time. So you can stop a stroke, stop a heart attack, and you can stop someone from bleeding to death. I had a friend that he had someone who cut their top of their finger off. And he used cayenne put it on the finger and stuck the finger back on, don't ask me, and wrapped it and left it. And the guy still has the finger today. So that was Dr. Silas.
I have to tell you, have you ever used it as an eye wash?
Yes.
Yes.
My sister-in-law does.
Yes, it helps with the eyes, bring blood circulation to the eye, and if you have any issues with your eyes, great for the eyes.
It feels good when it quits burning.
Yes.
Honey is also good for the eyes, you know, to help with eye ailments too, so.
My understanding is taken internally, it thins the blood. Taken externally, it clots
The blood, right, so it does both things.
Right, but don't take it in internally if you're trying to stop a blood clot.
Right. Well, if you're trying to,
Unless it's an internal blood clot.
right,
Yeah.
right. Okay. Let me just make sure I've gone through everything with, right, so we did the fact that it stops pain. Oh, the other thing that cayenne does is that it augments the activity of other herbs. So it can strengthen the activity of other herbs when mixed. My teacher taught me a combination of herbs that he uses for a detox, and we always put cayenne pepper in there because of that. And but there were some people who would burn their stomach so much we had to take it out. But it's used as an augmenter as well. And I had some other little tidbits about mullein and comfrey. For burns, comfrey is very useful just by actually wrapping the tea, the leaves from the tea on the wound and closing up the wound. In weeks, there's healing, good healing from using comfrey for burns. And then just for, in addition to the cayenne, you can also use for cuts and bruises mullein. You just wash the area. You can tear the leaves and just put it on there. Sometimes they say you chew it up and put it on the wound and it heals up in no time. So those were just some other little tidbits about mullein.
Randy, hold it up again for the camera. Randy, hold it up again for the camera.
Yeah, it's that real soft stuff.
It's fuzzy.
Do you have comfrey up here?
Yeah, it grows wild on our farm.
Okay. I'd like to see it because I haven't seen it in the wild, so
That's the man that's here, right there.
yeah. Any other questions?
We really need to let her get through the presentation because we have another one at 10 o'clock.
I'm finished. I'm just about, oh yes, with the sap. So you asked me what I thought about pine sap. And the truth is I don't have much experience with that. And I've read up on it. And the thing that stuck out was the fact that the turpentine comes from pine sap. So, and turpentine is used to draw things out. So, but I did see where they talked about you can apply it directly to the wounds as well, for healing of the wounds. But I'm not sure what the mechanisms are behind it. I'm I have a little science head, but also, so yes, I know it works. I don't know how, so I really, and I never had any experience with it. So from the research I did, it seems like it will work well, but I've never actually used it, so.
Can we do questions?
Yes, you can do questions now.
I have a question about the heating units. I've heard with the cayenne. I've heard a lot of different people's views of how you can take it and how to use what kind of heating units to use externally versus internally, and like what she was talking about, the eye wash, those kind of things. How do we know which one to use, and is there different, heating units for different situations?
Well, I have just always used the really as highest as I can get it because it's stronger.
Yeah.
The one I usually use when I'm doing an herbal preparation, what is it, 190,000? Yeah.
I have some 160,000 for sale.
Cellulose. Oh, cellulose.
Yeah, in little jars.
One of the jars.
Yeah.